Hi there, this is Dr. Tall Paul Simon, psychiatrist, talking to you from my home office with Monkey Joe. Please subscribe to this channel for more good mental health information from a down-to-earth psychiatrist. So let's talk about a monkey on our back here, smoking. How to quit, what can be done, how to do it successfully. All right, so we all know the risks of smoking. Junk in our lungs, increased risk for lung disease, lung cancer, all these kind of horrible things. So, and that also applies for vaping, though not quite as severely, but it's still there. Popcorn lung is one disease where your lungs will basically start to dissolve in a way and lose their function. So how can we quit smoking? How can we quit vaping? There's two main ways that it's done: subtly and gradually. So subtly is probably more difficult and painful for a lot of people, but occurs when something bad happens or there's some line drawn in the sand and say, okay, I have to quit or else something really bad is going to happen. I've made a decision. So when something bad happens, like a stroke or a heart attack, people will have a lot of motivation to quit smoking or quit vaping or make life changes. And that's great, but we don't want to reach that point of desperation and severe health issues before we quit. So what happens when somebody has a stroke or something like that and they decide to quit smoking? Well, they're motivated, right? So motivation is a strong emotion, a willpower that gets stuff done, right? So how do we nurture that motivation to make a change, such as quit smoking, without having something really bad happen? Okay, so when you quit smoking or vaping, there has to be will, right? So motivation, energy behind that. So one way to make that happen is to set a quitting date, okay? So, and making that quitting date important to you, such as the anniversary of a loved one's loss or death or something, or maybe a birthday or something that's important to you, where there's some emotion behind that. And then adding to that emotion, that will for that quitting time, you want to tell people about it, okay? Brag about it. Say, I'm going to quit on such and such date, and that will increase your level of commitment, because after all, you've told all these people, your loved ones, your friends, say, okay, I'm quitting smoking, and say, okay, you hold yourself accountable that way. So you want to pick a date and add an emotional strength to that motivation on that date, okay? Now, leading up to that, there are some medications that can help make that a little bit less painful. Two main ones really are Chantix and Zyban. Now, Zyban has been around for a while, also called Wellbutrin or bupropion. It works reasonably well, really well for some people. Chantix is a little bit more effective in my opinion. Either one can sometimes ramp people up a little bit, elevate their anxiety a little bit, make them a little bit more edgy. So on top of quitting smoking, it can sometimes ramp them up a little bit, and so you got to watch out for that. Irritable and that kind of stuff can come out. So irritability and stuff. So you want to be careful with that. Not for everybody, especially if you tend to be kind of an anxious, high-strung, edgy person to begin with. You got to be a little extra careful with those medications. Now, after that quit date, you sometimes will need a nicotine replacement, basically weaning off of the nicotine. So nicotine replacement is still a thing that we do quite a bit. So switching from tobacco form or vaping form, which is more harmful types of nicotine, down to like nicotine gum or something like that, and then use less and less over the course of weeks or months. Now, nicotine withdrawal, you've been through it before. Anybody who smokes or uses nicotine has had that. It can last for weeks, if not months. Now, it takes a long time to get over nicotine addiction. Nicotine is the most addictive substance known to human beings. So it's not as fun, perhaps, as crack cocaine or something like that, but it is actually a lot more addictive than even crack cocaine. So good luck. I wish you the best. It can be done. One other thing that's important point to make, with quitting smoking, a lot of times there's like an oral fixation kind of thing. You got to do something with your hands, okay? Now, a lot of times people will replace it with food or snacking, and that can lead to the weight gain. So nicotine and tobacco, smoke and stuff doesn't so much reduce the appetite as much as people change their behavior after they quit smoking and they start, eating more and stuff. So it's a behavioral thing, not as much a hunger thing per se. Now, some people will have some appetite suppression with nicotine and gain a few pounds, but it's really, an oral fixation kind of thing. So replacing that oral habit with something else that's not going to be, causing more problems like diabetes, because you start eating a bunch of candy, is important. So I see a lot of people use like toothpicks and things like that, or chewing on a toothbrush or something for a while, or using non sugar candies like hard candies, something to just kind of chew on, nibble on. I've seen some people actually suck on a pebble or a marble or something like that, but I wouldn't recommend that because that sounds a little dangerous. I think for some reason you get chipped teeth. So maybe stick to the toothpicks and the sugar-free candy, okay, or gum or something like that. So replacing that oral fixation. So take-home message, suddenly, okay, quitting smoking, but add to that emotional part of it, that drive and the willpower, okay? And commit to it by bragging about it, talking yourself up, committing yourself and holding yourself accountable, and recruiting that support in your social network to get that done. And then take advantage of maybe medications or with, nicotine replacement stuff. That's great. Now, another last point, quitting gradually also works for a lot of people. That's what I had to do, okay? So basically smoking a pack a day, every few weeks to a month, smoke 1 fewer cigarettes, okay? With that, you have to keep yourself accountable as far as keeping track of how many cigarettes you're actually smoking. So I had to actually use like a cigarette case. So in the morning, it's like an old-fashioned cigarette case. You may be seeing them around here and there. You can buy one on Amazon or whatever for $10 or whatever. So basically it protects the cigarettes. You put your daily ration of smokes in there, and every month or so you take one out and you have your daily ration. Fill them up in the morning, and when you run out, and that's it. And then you have to bum them from somebody else or something. It's less easy to do, I think, with vape pens, but you can restrict the flow on that, though it's a little bit more finicky. But smoking cigarettes, you can cut down with that trick. That's what I used back in the day, but I'm pretty old, and that was before we had vape pens and all that stuff. So again, I wish you the best of luck. You can do it. You've quit before, so you can do it again. Just, it'll stick better this time. Just keep up the fight, okay? You take care and subscribe to my channel for more helpful videos. You take care. Bye.